what is low risk and grade group 1 prostate cancer? Are those two terms interchangeable? Is there a difference?
Yeah, that's a great question. So traditionally, we have defined low risk, quote unquote, as grade group 1 plus a PSA under 10 plus a low stage tumor, meaning one that you don't feel or one that you can feel is just kind of a small nodule on exam. I think that definition pragmatically is evolving. That is still the formal definition of low risk. Um, I think these days we are also including a subset of men with grade group 2, meaning the cancer is mostly low grade with little specks of certain types of intermediate grade, at least in pattern 4, that are the less aggressive versions of pattern 4, if you will. So there's, we're calling these tumors favorable intermediate, but a lot of them functionally act like low risk prostate cancers, both the molecular level and the way they act clinically.
Yeah.
So anybody that's in this category, grade group 1 or small volume grade group 2, we are really pushing for exactly what you're describing, which is active surveillance. And it's a critical point to emphasize here is that we do need to follow these. And even if we change the name and don't call grade group 1 cancer, nobody is saying that it is normal. And there's certainly a subset of grade group 1s that will eventually show up as a higher grade cancer. So the program of active surveillance, which means following the cancer very closely, checking the PSA regularly, doing imaging tests like MRI at intervals, and typically doing confirmatory and downstream biopsies to make sure nothing's getting worse, that would all remain absolutely essential, even if we change the name. Because there are men that go for years and decades, exactly as you're describing, with nothing changing. And some men can literally go decades with nothing changing. But there's a subset, and it's a relatively small minority of these that do progress in a finite number of years. And we want to make sure we catch those so that we do not miss the window of opportunity to cure when cure is necessary.